Thanks for joining us for Building Racial Equity Principles for a More Equitable Partnership. I'm Kimberly Alexander, Principal and Co-Founder of the Alexander Group. I'm a passionate advocate for public health and equity with over 2 decades of experience in health policy, multi-sector partnerships, community engagement, and technical assistance. I'm also the co-chair for the Partnership for Healthier Durham's Access to Care Committee and founding member of the Racial Equity Task Force. I've also contributed author to Racism, Science and Tools for the Public Health Professional, an APHA publication through APHA Press. And so Marissa, would you like to introduce yourself?
Yes, thank you, Kimberly. Hi, I'm Marissa Mortiboy. I'm the Partnership for Healthy Durham Coordinator with the Durham County Department of Public Health. So I've been in this role for the past 6 years, and I'm responsible for managing the coalition and also leading the community health assessment and community health improvement plan process. And so I've been in public health for almost 2 decades, and I'm passionate about equity and incorporating equity into public health and how we function. So I'm going to start off our presentation with a background of the partnership. And so the mission of the partnership is committed to collaboratively improving the health and well-being of its community and those who live in it using racial equity principles. And we're a community coalition. We're made of different sectors such as health, education, nonprofit organizations, transportation, etc. And we work with representatives from organizations and also community members to improve the health of Durham County residents. And so this picture is from one of our communities that we work with. And so we have an initiative called Healthy Mile Trails to establish walking routes in neighborhoods. And in this picture, Ronnie, who's on the right, led that initiative in his neighborhood, and the community decided they wanted more. And so they started a community garden. And so this is a picture of his family and some community members in a community garden they started as a result of the work with Healthy Mile Trails. And so I want to share about the structure of the partnership. And we revised the structure in 2018 after our 2017 community health assessment. We had a new priority area of affordable housing, which was #1. So this was new for us. So we had to decide how were we going to address that within the structure of the partnership. And so we have 4 committees around health priorities, which you can see on the slide: access to care, health and housing, obesity, diabetes, and food access, and mental health. And so we had a lot of discussion because prior to 2018, HIV and STI was a committee. And so we had discussions about whether keeping that as a committee and or do we need a housing committee? So we decided that the community told us that affordable housing was the top priority. And so we really needed to acknowledge that. So we formed a health and housing committee to really show people and emphasize that relationship between health and housing, because in talking with community partners before we started the committee, that was a gap. It was the relationship between health and housing. And so those are our committees. And then we also have one standing committee for communications to address internal and external communications for the partnership, to increase how and improve how we work together, but also communicate what we're doing with the public as well. And so each of our committees has 2 co-chairs, which make up the steering committee, along with health department leadership. And you could also see the offshoots from the steering committee is the NC Care 360 task force, and also the associate committee on poverty. So poverty is one of our top health priorities, but we engage with existing efforts. And so we did not start a committee on poverty. And also NC Care 360 task force, we have an advisory council. And so it's going to look at the engagement and the performance of NC Care 360 to make it sure it's working properly for our Durham residents and it's meeting their needs. And then you can see at the top of this structure is racial equity principles. And so we also had debate when we were restructuring about whether we should have a racial equity committee. And we came to the conclusion that we wanted principles that would be overarching to everything that we do within the partnership. And so I'm going to turn it over to Kimberly to give some background on how the Racial Equity Task Force came to be.
Sure, thanks, Marissa. The Racial Equity Task Force grew from years of racial equity training and a few focused members. The partnership, in conjunction with the Department of Public Health, supported partnership members to attend 2-day intensive racial equity trainings. The Racial Equity Institute, based in Greensboro, North Carolina, trained several partnership members over the past few years. And the cohort who had been through that training really wanted to make sure the partnership was benefiting from that equity lens that we learned about and gained. One of the committee co-chairs also focused her master's internship on applying a racial equity lens to the partnership. Later on, you can see there in the green jacket, Jana Behrens, who is now a racial equity consultant with the Michigan Public Health Institute, brought all sorts of resources and background work into her recommendations. One of those recommendations was to have the partnership develop its own racial equity principles. And so the steering committee supported that effort and restructured to include, as Marissa just showed, the overarching racial equity principles. So in April of 2018, the Partnership Steering Committee proposed that 2018 to 2021 partnership structure in response to racism and discrimination as the 6th health priority from the Community Health Assessment. And so partnership members were wanting really next steps around racial equity after attending those trainings, and really the new structure was approved in April 2018. So Marissa, I'll pass it back to you.
Okay, and so so thinking about the process for racial equity, and that's my role is, the partnership members came and said, this is what we want. So what does this look like? And we had our first meeting in July of 2018, and we invited partnership members and people from outside of the partnership to be involved. And so our charge was to develop principles, as Kimberly said, for the partnership, but we didn't have a set way to do that. And so that's what the group came together to do, is have conversation, determine the best ways to do this. And so our first meeting, we talked about the partnership and the background, and also had conversation and came to a consensus to determine goals, a timeline, realistic principles, and also discussed anti-white supremacy culture. And we had the experts in the room. Everyone wasn't necessarily working in racial equity, but through lived experience and the work and learnings that they had, that we felt that we had the people in the room to do this. And so we let things happen organically. And so I facilitated the conversations, and at the first meeting, the group suggested a half-day workshop to make progress even faster. They felt that hour or hour-and-a-half meetings each month wasn't going to make the progress that we needed in the time that we needed. And so they suggested a half-day workshop. So we set this up, and we had this in October of 2018. And so these are a couple of photos from that half-day workshop. And so what it consisted of was the partnership overview, so making sure that everyone had a background and context for the partnership. And we also discussed framing power. And that's Jana Behrens again on the right, and shared framing power, and that is the structure for racism. Also, the Emergent Strategies book as well. And so some language and for things for us to think about. And also equity and the need to build relationships, because that's really key in anything the partnership does, is building relationships, but also for this racial equity work, because we had honest conversations. And so we really had to build those relationships to make sure we felt safe and comfortable to be able to be authentic. And so the charge of the Racial Equity Task Force is to develop the principles to be used by the partnership and guide how all the committees operate. And so we also know that when we develop these, that we need to go to the steering committee for review and then to the full partnership for a vote. And at this meeting, we also had examples of racial equity principles. We had an intern who worked with us, and she did a lot of research and to bring those resources to the group as well, to use that in our discussion and decision making. And the picture on the left, in the half-day meeting, we worked in small groups. And so we were developing ideas about what we wanted the principles to look like. So we got into small groups and had discussion. And then also you can see in the picture on the right that we shared out to the results of those discussions. And so we used a vision activity. So as we worked in small groups, it's to identify where we'd like to go as a task force. And so the vision activity was groups first thought of what life looks like today and then put themselves 10 years in the future to visualize what is happening, what is the ideal state with racial equity within the partnership in Durham. So this was to give us a larger vision of what we wanted to work towards. And we knew that we didn't have control over everything in our vision. We could only have control over the partnership, but this helped us give us a base for where we wanted to go. And then attendees worked individually and then in small groups to brainstorm ideas for the question, what should the partnership racial equity principles focus on? And so after sharing ideas, the group clustered them into the following areas using the TOPS facilitation method. And so these pictures are not from this meeting, but of the TOPS facilitation method using the sticky wall. So individuals write down their ideas and then they stick them on the wall. And then as facilitator, that I group them into what it looked like the groups that they belong to. And as we built consensus, we moved ideas around and we formed groups. And so ideas that all belong together were considered one category. And so we did that. And then we named each categories and those eventually became our principles. And so another tool that we used during this process was storytelling for visioning. And this is from Nonprofit Hub. And it's called a step-by-step exercise for creating a mission statement. And it's got a series of exercises. And so it uses storytelling to get to the heart of your mission and also the core of what you do. So this was made for nonprofits, but we used it for the partnership, and it's a great tool, and it's another way to go about the visioning process using storytelling. And so it's not just writing ideas or just brainstorming, but really getting the bigger picture of what your organization does. So we found that extremely helpful. And so moving on to the outcomes from this process. And so Kimberly had mentioned that this went to the steering committee, they approved the principles, and then the entire partnership, which is in this picture for our quarterly meeting, we sent out a survey beforehand and partnership members voted. So it was overwhelmingly approved. I think it was about 94 to 95% approved of the principles as we had worked on and had written. And so we officially adopted them at the October 2019 meeting. And at that meeting, Kimberly and another member of the partnership made a presentation about our process and to give additional context to. And so we also shared the final principles and the revised mission and vision at that meeting. And we also left time for discussion because we feel this is extremely important that we work collaboratively, but also give people the space to share their concerns. And people did share concerns that we didn't go far enough or some about the language. So we did make some more adjustments, but we just want to make sure that everyone is on board and everyone feels like they have a voice in this process. So next, I'd like to share our new mission. You can see the previous partnership mission on the left, which is the Partnership for a Healthy Durham is dedicated to collaboratively improving the quality of life of its community. And our new mission, which is our current mission, is the Partnership for a Healthy Durham equitably and collaboratively improves the health and well-being of its community and those who live in it with racial equity as the guiding principle. So we added some more language here to be intentional. And so we added equitably and equitably as well. And so the well-being of its community as a whole and those who live in it, referring to the people who live in the community and making sure that we added that racial equity is our guiding principle. And so for our new vision, you can see on the left, the previous vision was the people of Durham will enjoy good physical, mental, and social health and well-being. And our new vision is all people of Durham have equitable opportunity and ability to enjoy good physical, mental, social health, and well-being. So we felt that was important, again, to add equitable, but really that opportunity is key here because we know that not everyone has equitable opportunities. And for our vision, that's something that we really want to see. And so these are our 5 principles. I'm going to go through them just to give some more detail about what we meant when we developed these. And so our 5 principles, and this is as a result of the TOP facilitation process, when we were brainstorming in groups and coming up with ideas, and then also using the sticky wall to categorize them. And then we named those categories. And so these are the names of those categories from that process. So the first is cultivate community power and leadership. And so what I mean by this is supporting community organizing through capacity building. We want to support those who are out there doing the work, grassroots organizations. And we also want to increase community involvement and leadership within the partnership because of the way that we're structured. Our meetings are during the day, that we have a lot of people, most members represent organizations. And so that's something that we like to shift. And so those are strategies that we're going to have to build to make sure that community members are not only attending meetings, but are really part of the leadership and decision-making of the partnership. And we want to share that power. And we know that the way health departments and government agencies are structured, that makes it very difficult to share power, but that's something that we want to move towards, is sharing power and resources with the community and community members as well. And so our next principle is transforming systems using justice and accountability. And we understand that we can really only enforce change within the partnership, but this principle refers to advocating for systems and policy change. And so we know there are inequities within the health system, education, criminal justice, pretty much all systems, but using our voice to advocate for systems and policy change, and acknowledging that all systems contribute to systemic, avoidable, and unjust outcomes. And we really want to build that equity culture. And so those are the main things that go into transforming systems using justice and accountability. And as far as operationalize internal equity, and so this is increasing access and removing barriers. And we had a lot of discussion around this. Well, do those mean the same thing? And we decided that they don't. So increasing access to being part of the partnership, but also at the same time removing barriers. I mentioned the time of the meetings, but there are other things too, such as people may have challenges with transportation, or meetings don't have food or childcare, but also thinking about even the culture of our meetings too. They're very institutional with, formal agenda, a lot of professionals attending the meeting. So removing those barriers to make sure that we can truly engage and build authentic relationships with community members. So our next principle is connecting our humanity. And so this refers to value ongoing relationships and lived experience. And so this was how the Racial Equity Task Force was set up, was to really focus on those with lived experience who may not have official titles, but really brought their viewpoints and their perspectives and their knowledge to the conversations and the discussions. In fact, we had one meeting in February of, I believe it was February of 2019, and our icebreaker question was, share a Black history fact. And we went around the room. It took about 45 minutes, which was half the meeting, but we learned so much. It was such a rich discussion. We actually learned that people who had been living in Durham their entire lives knew about history and just knew so much about what had happened and desegregation in schools. And so we actually built off of that. In our July quarterly meeting, we focused on housing in Durham, and one of our members of the task force is also a co-chair of one of the committees too. She shared her personal stories. We had someone talking about the history of housing and inequities, but she shared her story of how it impacted her family. And it was so powerful because you could have the policy aspect of it, but then to have the personal perspective of what happened in Durham and how she and her family were impacted. So really focusing on that, and also while leading with race, build partnerships and work collaboratively with other marginalized groups. So we've been in discussion about working with grassroots organizations and looking at who our partners are, where our gaps are, and really addressing that. And then our fifth principle is admit language and history matter. And so this means continuing the conversation on the terms that we use, making sure that we're inclusive and that we're not maintaining inequities through our language, and being explicit about the history of race and its contribution to racialized outcomes. And this is something that we've been doing more with the health department, but also increasing the partnership. So we've had a couple of exhibits about housing inequities in Durham and history, and also the history of health system, health disparities as well. So that was a project through Duke, and professor actually came and put a display in the health department, presented to the partnership quarterly meeting, and discussed the history of segregated healthcare in Durham and also the outcomes of that. And so continuing to do those things, but admitting that history matters to the health outcomes that we see now. We've started putting that in our reports, or started State of the County Health Report, the Youth Risk Behavior Survey Report, and also doing that for our community health assessment that's due in March of 2021. So really acknowledging that link between history and health outcomes and health disparities as well. So I'm going to turn it over to Kimberly, and she's going to talk about phase 2 of our racial equity task force.
Thanks, Marissa. So while phase 1 really defined our health equity principles, phase 2 is really application. So now we have these 5 principles. We know what they mean, and we have robust conversation that's happened to be able to make those happen. Marissa gave some examples of how those have already been implemented, but phase 2 is really focused on how we apply those internally to the Partnership for Healthy Durham subcommittees. And we really wanted to focus, if you go down, Marissa, onto what the partnership identifies and what that should look like in the application. We've had discussions from our catering and making sure that we preference minority and women-owned businesses in catering, looking at our contracting. We've had lots of discussions about what that looks like. Marissa gave some examples of community meetings. Some of the subcommittees have been meeting in different locations around the communities before COVID. Now we are doing virtual meetings and have had quite a bit of participation from folks that hadn't been able to participate before, but also looking at those challenges and barriers. And then define the identity and role. Marissa talked a little bit about defining our identity. We've realized that as the partnership, we are made up mainly of folks that are representing organizations and here in a professional role, rather than folks that are representing different neighborhoods or community groups in Durham. And so then defining community. Who are the folks that we want that our focus is for? It's for the entire community of Durham. And when we're looking at folks that are most affected by disparities and inequities, we want to make sure that we are naming those communities explicitly. So if we're talking about Black and Indigenous people of color, that we name that specifically along with those principles. So those are our next steps for phase 2. Next slide, Melissa. I want to talk about lessons learned. Throughout this process, Marissa described a little bit about the conversation in the meeting when we asked, our icebreaker was around a Black history fact. And we made space for that to be able to take half the meeting because there was so much rich discussion. So it's been a non-linear process. One of the resources that we'll share later talks about white supremacy cultural norms and how in an agenda things have to flow in the specific time that's allowed. Part of our lessons learned, we're learning that that doesn't always work for everyone, and making space specifically in the Racial Equity Task Force for a non-linear process. That relates then to reverence for lived experience. We have some elders who have been part of this group who have a particular topic that they like to talk about. We've talked about reparations and how that applies in different settings, and making space and revering that lived experience, understanding that when everyone comes to the table, they come to the table as an expert in their experience, and having, making space for that. And then leaving space for conversations. That's that example, not just in that one meeting, but those connections that then lead to relationship building are really about conversations and getting to know each other. Marissa talked earlier about relationship building, and that is one of our main lessons learned, that in order to be able to see each other and think about each other in more equitable ways, those relationship building, not just individually, but between organizations and as a whole, that we have an identity as the partnership. And then cultural norms. Thinking about those things that may exist in COVID is a great example. We've had folks who have children that are at home at the same time. And so making space for folks to be able to say, hold on just a minute, I've got to go help with this homework assignment. or taking bio breaks during a Zoom meeting, really thinking about the way that we can be supportive of all of our members so that people feel heard and welcomed and understood. I call it giving grace for lots of different things and understanding everyone's situation. I'm kind of surprised my cat hasn't walked across my computer right now. We're just making space for all of those sorts of things. So those were some of our lessons learned from this almost now 2-year process that we've been a part of. And Marissa, we can go to the next slide. And we know this is the recording that you're watching. Thank you for making it with us this far through the recording, but we'd love to have some interactive time. And while we can't answer your questions specifically now, we'd love for you to name one of the 5 racial equity principles developed by the partnership. You can email that answer to Marissa at mmortiboy@dconc.gov by noon on October 9th, and you'll be entered to win a drawing. We'll be able to share more about that, but you have Marissa's email there, and then we'll share it again at the end. But we'd love to have you share a little bit in remembering about what you learned about our principles. So we hope that you take a moment. You're welcome to pause the recording now to think, and then go ahead and email Marissa with that one of those 5 equity principles.
Thank you, Kimberly. And so one thing that we wanted to make sure that we do when we did for this presentation is also to talk about our experience and our process, but also give you some resources and tools that you could use. And so you can develop racial equity principles or really be intentional about incorporating equity into your work. So I want to share a couple of facilitation methods that I use. And so this one with the sticky wall and brainstorming and putting pieces of paper up, moving them around, naming categories. That's called the top facilitation method. And so that's one of my favorite methods. I've been trained in it, using it for years. And so that link is to the international organization. It lists trainings and has all the information about cost and everything on there. And so it's very valuable tool. It has been also used in the community health improvement plan process. And so it's been really helpful to us in multiple ways. And the second one is the Nonprofit Hub step-by-step guide for creating a mission statement. And so this is what I was talking about earlier with the storytelling and visioning. And there's the link for that. And it's great. It's step-by-step. It is used for nonprofits, but again, we found it useful and we used it as well. So I'm going to turn it over to Kimberly to talk about some additional resources and tools.
Sure. So thanks, Marissa, for sharing about some facilitation tools. Now we want to make sure that we give you some racial equity organizations and specifics. If your organization is not as far along as having been through trainings or would like to look at some different resources, the Government Alliance on Race and Equity is a great resource. You can see their website there. They bring together local groups that are working across the nation on racial equity to be able to contrast and compare and be able to be a sort of cohort of government organizations that are working together. And so we've had some experience with that in Durham and specifically a few places in North Carolina that are participating in that work. The Racial Equity Institute is based in Greensboro, North Carolina. Mentioned them earlier. They provide the Phase 1, which is a 2-day training that gives a lot of the history of race in the United States and how race came to be and who came to be classified as which race, how those are identified and laws and steps that have taken us to our current classifications today. They also offer a Phase 2 training where organizations come together to look at the ways to implement racial equity in your specific organization. And now they've expanded to do Latino or Latinx challenge that focuses on the Phase 1 and Phase 2 focus on the bookends of Black and white and explain where folks fit in that. But the Latino challenge also does the history of the Latinx community in the United States and how they've become racialized over time. Next slide, please, Martha. And then some resources. So Communities in Action, Pathways to Health Equity Report from RWJF and the National Academies of Sciences, Engineering, and Medicine is a great tool to be able to learn more about things that have gone on across the country. Human Impact Partners has their Health Equity Guide that includes a lot of resources there. They have a great listserv that shares promising practices and organizations that are continuing to work in this area. And then a professor on the faculty at Duke University shared an article, White Supremacy Culture, that talks about some of the norms that we assume are professional that really relate to white supremacy culture, and understanding that there's room to incorporate culture, like we talked about, some of those lessons learned that make room for everyone and their culture to be able to participate. I believe we have one more tool. Yes, so the groundwater approach. The Racial Equity Institute uses an analogy of the groundwater and how it's connected across systems. And so that's a great way that we use to frame how systems are connected and what inequities, how those are defined across systems, although they have different names in education and health and juvenile justice, the criminal justice system. They're the same groundwater. And so definitely would recommend that one. And then Race, the Power of Illusion is a clip that talks about how race came to be and the way that people are classified. And so that one's a YouTube video. There are tons of resources. This is definitely not an all-inclusive list, but we wanted to make sure to give you some things to get started. No matter where you are in your journey, there's always room to learn and to grow. And so we wanted to provide some of those tools and resources. All right, Melissa, I think I'm handing it back to you now.
Yeah, and so I think Kimberly will put our contact information up for questions. And so Kimberly's email and my email and phone number. So if you have any questions about our process, any of the tools that we use and the information that we presented today, we could also go to the Partnership for Healthy Durham website. It's www.healthydurham.org. And under About Us, Health and Equity, we have minutes from our meetings. We have these tools that we've shared as well. And so we can find information on our website about our principles and our health equity work. And I think we want to take a few minutes just to take time for reflections about this process and this work and how it's impacted us. So if you'd like to share first, Kimberly.
Sure, thanks, Marissa. So part of the reason I've been involved in this work for so long is coming to the Partnership for Healthier Durham. I hadn't been through a formal racial equity training, and so my first was the one sponsored by the partnership, where the Department of Public Health, the Durham County Department of Public Health, set aside money in their budget to be able to have members of the partnership attend the 2-day Racial Equity Institute Phase 1 training. And it really helped explain a lot of things that I didn't understand about the work that I was doing, from policy to healthcare, and looking at how to link things. And so once I was able to use that lens, then applied it to all my work in for-profit and nonprofits and volunteer work, and decided that it was really an important part of all the work that I would do, and went from an education academic setting for work to for-profit, and have now started my own consulting firm where I'm able to do this type of work, and really credit my experience with the Partnership for Healthier Durham and being introduced to the Racial Equity Institute with sort of that career motivation. And just want to say thank you to Marissa for her work in helping that happen. The Racial Equity Institute encourages folks to get involved in local organizing, and through the Durham Organizing Against Racism Caucus and some colleagues in Greensboro, the Greensboro Health Disparities Collaborative, who implement this work in a healthcare setting. While racial equity can be applied and should be applied to any and all fields, in our field of public health and healthcare, there's some specific work going on with the Greensboro Health Disparities Collaborative, and who contributed a chapter to the APHA Press publication, Racism and Health Tools for Public Health Professionals. So I just wanted to share that this has really been a profound professional impact, but also personal, and has helped shape some of my journey. So thank you for making that possible, Marissa.
Thank you, Kimberly. I'm glad it's had such an big impact on you. And so I just like to share. So I've had professional and personal impacts as well. So personally attending the training, and then once you go to the training, then you can go back as an alumni and as many times as you want to, because you always learn something new at those 2-day Racial Equity Institute trainings. And so from there, I've just done a lot of reading, documentaries, just to learn more, because this has really informed, you know, my work in public health, but also with the partnership. And so it's really helped us to look at root causes. And so you may look at, you know, someone who has poor nutrition habits. Instead of, you know, well, we need to do cooking classes for them, it could be that they don't have access to fresh foods. It's, you know, it's not in the neighborhood, and looking at those root causes. Well, why aren't there grocery stores in that neighborhood or in that community? And so looking at that and really addressing root causes and structural issues instead of just the outcomes and health behaviors. And we also, through the training and also through other readings that I've done and documentaries, other things that I've watched, just see how systems were created and how that ties into the impact of the health outcomes we see today, and why, you know, people and communities are situated differently. And I think this work has really strengthened the Partnership for Healthy Durham too. I think that we've been able to have better, deeper, more authentic conversations about our identity, who we are, where we want to go, and also for our membership as well. And so anytime you make change, you're going to lose some people along the way, but the people who do stay with you are the ones who really want to be there and do this work. So I feel like it's really impacted us, and we've been having conversations across the entire partnership, not just the Racial Equity Task Force, but also our steering committee about the way we make decisions, what goes into those decisions, and also our committee work too. And just the Racial Equity Task Force meetings, we've talked about some of the things, you know, the icebreakers that took 45 minutes, but I mean, these meetings were different than other partnership meetings because, you know, we had things that we wanted to talk about, but we didn't stick to a strict structure. And so Kimberly said this was non-linear. We got where we needed to, but it wasn't, you know, this is exactly the way we're going to do it. You know, we're going to follow these exact steps and we're not going to deviate from it. So we took the time that we needed to, took the process that we needed to. And so I think that made for a really great space for those meetings. And I really enjoyed those. And I know there were comments in the meetings too that people, you know, this was their favorite meeting. They had looked forward to it every month. And so, yeah, so I think that's this work has really enriched me personally, but also professionally too, and the Partnership for a Healthy Durham Coalition. So I don't know if you want to have any closing words, Kimberly?
I just want to say thank you to the viewers that stayed with us. We would be happy to answer questions. You have our contact information here. And don't forget about our interactive quiz where you can email Marissa one of the 5 racial equity principles to be entered for a drawing for a prize from the partnership.
So thank you again for listening. And again, if you want to find out more about the Partnership for Healthy Durham, visit healthydurham.org. Have a great day.
Be safe and well, everyone. Bye-bye.